So the reason that you're going to be doing the program to help other young people, excuse me, to help other young people like yourselves that may be affected with a blood cancer, so we will hopefully be able to find a cure within your lifetime. There is a little bit of information that I have for you guys, some fun things that your school has set up for you so you can put the fun back in your fundraising. On March 5th, you guys are going to be teaming up for leukemia, which means it's going to be a dress down day where you guys can wear a team jersey of any of your favorite sport teams. And then you're also going to be having a bake sale the 11th and 12th of March that'll go towards your fundraising for this. Does anybody have any questions for me about? Oh, yes, we do. That's a great question. The question was whether or not leukemia can stop you from doing any of your favorite things. If you're talking about when you're in treatment, you do get weak from leukemia. That's one of the things that happens. You get weak and you're kind of like sluggish and tired all the time. As a result of that, sometimes you have to go into the hospital to get chemotherapy. And so that means that sometimes you can't be around your friends for periods of time just because your immune system, which keeps you healthy, is very low and weak. So sometimes you can't be around your friends for a while, but CHOP Hospital, which is down in University City, Children's Hospital of Philadelphia, they have done an excellent job of creating these suites for young people that are in the hospital with different type of cancer treatments. And in there you have computers so you can stay in touch with your friends, and you have PlayStations, Xboxes, Nintendo 64, all the games that you can play. So they try to do a good job of keeping you happy and being able to do fun things while you're getting treatment. But sometimes you can't do everything you want to do, unfortunately. Does that answer your question? Yeah? How do you get leukemia? It's a question I get often, and I always get a great response when I tell you that we don't know. That's one of the most frustrating things. As you can imagine, it's really difficult to find a cure for something when you don't know what causes it, and we don't know what causes it, to be very honest. We do know a couple of things about it, though. We know that it's not contagious, so if you know someone who has leukemia and you're around them, you can't get sick or get leukemia from them. We also know that it's not something that runs in the family, so that means if your grandmother had it or if your aunt or uncle had it, that doesn't mean that you could possibly get it like some other cancers. And we also know it's not caused by anything in the environment. So, you know, a nuclear reaction, anything that doesn't cause leukemia. Right there with the blue shirt. You're pointing to yourself? How long does it last? It really depends on every different person. Every person's different. So, and it'll also depend on your treatment. So some people will go in, they'll get treatment, and they'll be healthy again in a year and start on their road to recovery. Some people that doesn't happen for. One of my close friends, he was considered cured, and then he unfortunately got it again. But now he was in treatment for about 2 years before he was considered on the road of recovery, and now he's pretty healthy. So it really depends on each person and what type of that strain that they've gotten will affect them. With the glasses. Is there only one type of? No, there's multiple different types of medicines. So sometimes there's usually, like when you go into the hospital and they find out that you have a blood cancer, they'll give you this one type of treatment, chemotherapy, as we discussed there. But sometimes chemotherapy doesn't work for people, or sometimes that particular type of chemo won't work for people. So they'll have to tweak it. So there are a lot of different types of medicines to make sure that we find a cure. Let's see, right here. What medicines can you take to make it go away? Chemotherapy is one that you can take with either an IV, which is something, the needle that they put in your arm, or there's also a pill form of chemotherapy that people can take. Then there's another medicine that actually the leukemia and lymphoma helped to develop called Gleevec. That really helps. That's helped us a lot in the fight against blood cancers, and it's also currently helping in the fight against breast cancer. And then there's a whole bunch of other medications that I will not get into because it will probably get very, very boring. And I'll take one more question with the pink shirt in the back. Why do you bruise easily? You bruise easily because of the different cells, the white cells in your system and the platelets. The blood isn't doing everything that it should do, so they can't form. I'm trying to figure out a way to make it not very technical. I'm sorry. The white blood cells aren't doing what they should be doing, so when you get the bruises and things that they're weak, so they can't do the normal things that should happen in the blood when you get a bruise. So that's why you bruise easily. I don't know if that makes a lot of sense, but I don't want to get really technical because it'll be really confusing. There's something that I want to do for you guys though, and if Ms. Kent will come up here. Your school has been fundraising for quite some time, and as a result, we have a plaque here for you guys, and it's recognizing the hard work that you guys did last year in raising over $5,000, and we wanted to present your school with this so you can display it. And then another thing that's going to be different this year in your campaign, I know in previous years it was the top fundraising class. They would get to go to the Olive Garden for the pasta lunch. This year your school is going to be doing any school that raises, any class that raises over $300. You'll be entered into a drawing, and your name will be, the school's teacher's name will be picked out of the drawing pot, and that person that's picked will get to do the Olive Garden lunch. And then any classroom that raises over $350 and is not picked out of that drawing will get a pizza party provided for you. So, I want to thank you guys for being such a very excellent audience. I also want to tell you about, I also want to tell you about this individual coin boxes that you guys will all be receiving. This box is just for you to take it home and to put your pennies in there, or your coins, nickels, dimes, whatever you feel comfortable putting in there. It's just for you to take home and have it in the house and bring it home. Maybe if you go over to a cousin's house, she'll bring it with you, but it's not for you to go out into the neighborhood and go up to people in your neighborhood and ask them to give you money. We don't want you to do that. It's just a little carry case for you to bring your change back and forth to school. It's kind of cute, right? You like it? You like it? Yeah? All right. So thank you guys for being such a great audience, and I wish you guys success on your